My name is Amanda McCarthy. I'm the Director of Social Determinants of Health at Advanced Health, a Medicaid CCO organization serving Coos and Curry counties on the southern Oregon coast. I have worked with MedInsight for 3 years, and before that, Milliman PRM for about another 7. Advanced Health is a Medicaid coordinated care organization. We are in charge of coordinating physical health, behavioral health, oral health, substance use disorder treatment, transportation for our members. We are unique because we are locally owned and operated. We live, work, play, and age in the communities that we serve, and that makes us very much in tune with the needs and wants of our population. Advanced Health has a mission to improve health outcomes for its members, and one of the ways we do that is through monitoring population health. And these often take the form of metrics. And in order to really understand metrics performance, we have to understand where we've come from and where we're going to, and we do that with data. And historically, data has been claims-based. A provider sees a member, they submit a claim, there's a diagnosis on that claim, there's CPT codes to really describe what service was offered. With the introduction of electronic health records, we really understood that there is so much more data that is captured in the process that is not reflected in claims. And the state of Oregon, who really sets these measures every year and is in charge of really monitoring and providing oversight for performance for each individual coordinated care organization throughout the state, they started to really look at what it would be like to add that clinical data into these measures. And so we have a number of incentive measures, we call them, they're population health measures, that leverage that clinical data. And knowing that we were going to be required to participate and that we wanted to participate, we partnered with MedInsight to understand what it looked like to get that data from the EHR and to use it to calculate rates. Advanced Health's quality team uses MedInsight's final output in the way of monthly reports and provider dashboards to really move the needle on process improvement and performance on metrics. The member level data that's provided in our monthly reports is a platform for care gap closure. We're able to take that, we're able to divide it and by provider and disseminate it through the provider network and say, these are your members, these are your patients who are going to end up in the denominator of this measure, but they have yet to receive a service that they need. And so do your outreach, get them in the clinic, and when they're there, use your standardized processes to make sure these things get captured in the structured data that's required. And so we use it for that engagement between the provider and the member. We use it to let the providers know where they are on a performance basis, if they're this far from the goal or if they're closer to the goal than they thought they were. And then we troubleshoot and we think about ways to build interventions for them to really move that needle. MedInsight adds value to Advanced Health in its ability to provide more actionable data. I think in healthcare we have really seen this change from claims data with lag and run out to near real-time electronic health record clinical data. And what happens is that with that visibility, we are able to make changes for improvement quicker. We're able to be transparent with our providers about their performance quicker. We're able to really understand how the data comes together and what that process is and troubleshoot issues. If we're seeing a change in the rate that we don't expect, we can follow that structured data all the way back to the workflow to make sure that nobody's missing a step, that through turnover in allied staff, that things aren't being forgotten or dropped. And then, we're also able to start to really look at this data from a perspective of inequities and understand to further dice that data down by, race, ethnicity, language, disability, all of those aspects. So it really gives us a more comprehensive view of our population as a whole. I appreciate our collaboration with MedInsight because of how diverse it is and how intentional it is. It is not easy to transfer data. Data is always the crux of some of the issues that we run into. And knowing that I could send an email or get on the phone with my collaborative partner at MedInsight to troubleshoot, to work session, to describe how this output is not what I expected is valuable. It's not a space where they're the expert and I'm the client. This is a space where they're an expert in this data flow and how to get it, and I'm the expert in what it should look like because I understand the community and the historical performance. And those two approaches coming together makes our collaboration very, very robust and fruitful.